The Conservative MPs, including the current immigration minister, have called for a rethink of the post-Brexit visa system, and in particular the decision to add care workers to the shortage occupation list in early 2022. Now, there's been a lot of discussion in the House of Parliament as regards stopping the health and care visa that allows foreign workers to move into the UK as care workers, and also to remove the care assistant job role out of the shortage occupation list. And this conversation has been going on in the House of Parliament for a couple of weeks now, and there's been a lot of information circulating as regards whether the health and care visa is going to end. So this video basically is to put clarification and to state the fact on this particular information, and also for me to share my opinion and personal thoughts in relation to the information about the health and care visa coming to an end. So if this sounds like something you'd like to listen to, keep watching to the end. And if you're coming across this channel for the first time, do hit the subscribe button to join the amazing Korean family. And my returning subscribers, thank you for being here. I really do appreciate you guys. So without further ado, let's get right into the video. There has been lots of information circulating in the media for the past couple of weeks, and this is in relation to the health and care visa in the UK. One news media outlet said there's a call for rethink as care workers visa now make up to 2/3 of the health and care scheme. Another media outlet said that the UK migration advisors calls for tight foreign worker rules, and this is basically the idea that many people are a bit bothered, especially those in government. There's been a lot of debate in the House of Parliament as regards if the UK really need the the number of foreign workers coming into the UK through the health and care visa route. Now, the UK government's migration advisors have called for the abolition of one of the main routes through which employers can hire overseas workers in sectors facing chronic shortage occupation. And the Migration Advisory Committee tasked with reviewing the shortage list for which visa conditions are loosened said on Tuesday that the current system was liable to drive down wages and leave workers open to exploitation. Its overall economic benefits were also doubtful, and many employers were unable to afford the high fee for using the system. That's what the Migration Advisory Committee said a couple of days ago. And they further said that we are not convinced that the shortage occupation list is an effective tool to address the labor shortage across different occupations and sectors. Now, basically what the committee are saying is that the shortage occupation list is really not tackling the shortage of professionals in this field, and many of them are of the opinion that the health and care visa is not really been effective, and it's a very big mistake in their own part to have added the care assistant role in the shortage occupation list. Now, inclusion to the shortage occupation list allows employers to hire outside the UK for 80% of Britain's going rates for the occupation down to a minimum of £20,960 a year, compared to the threshold of £26,000 under the main skilled worker visa route. For care workers, the usual skills criteria have been waived. So in the opinion they're thinking, or they're saying that many times if you're applying for a skilled worker visa, one of the things that will give you a point is to ensure that the job you're getting, the salary threshold is no less than 26,000. But that's not the case for many of the healthcare jobs right now. There's some healthcare jobs that pays as low as 20 to 21,000 pounds, and these jobs are also still eligible for the visa sponsorship. And what the members of parliament are saying really is that, now aside from the fact that the salary threshold for many of these healthcare jobs is not up to the salary threshold required compared to those coming into the UK on the skilled worker visa, they're also bothered that so many employers are bringing in foreign workers who don't have the exact skills to take up the health and care job, which is really one of their major concerns. And that is the sincere truth. Even for people who are coming into the UK, through some private organizations or some private care homes, many of them are still struggling to get jobs. I know of people who have not worked with their employer for the last 6 months of being on the job. And this is not because the jobs are not available. This is because many of these private care homes or private care organizations don't have as much shifts or as much job compared to the number of people they are recruiting, both locally and from the overseas. So the Mark and the members of parliament are a bit bothered that the usual skill criteria have been waived for so many of these jobs because the country is desperate for care workers. They also say that, but there have been widespread reports of abuse by employers who underpaid care workers or charged them inflated relocation costs if they sought to change job because of poor working and living conditions. So this is something that is really happening to so many people who are currently in the UK on the health and care visa. Now the committee said its reviews was based on the principle that employers should no longer be allowed to pay wages below the UK going rate. So many people that are even in the UK on the health and care visa are not paid properly the way their counterparts in probably the NHS are being paid for the same job role. So this means that there would be no point keeping higher paid occupations such as architects or IT technicians on the shortage occupation list, as employers willing to match UK pay rates could already use the main skilled worker visa. Nurses and other NHS workers were in any case on the national pay scale. So they are saying basically that the health and care visa being on the shortage occupation list, it shouldn't be there in the first place, that the purpose of it being there is not really being actualized. So this represents so they're saying that in the year to June 2023, 77,000 long-term work visa were granted to care workers in the UK, and this is a 6-fold increase from 12,300 experienced in the year 2022. Now this represents around 2/3 of all the 120,000 health and care visa work visa issued. Now the government added senior care workers to the shortage occupation list in 2021, followed by care workers in February 2022, in a bid to fill the rising number of vacancies since Brexit and the end of freedom of movement. And some critics have said that at the end of the scheme of care workers, an MP told Sky News that they've called for a closure of the routes because there are 30,000 BTech students in health and social care, over 1 million unemployed, and 700,000 on the sickness benefit keen to get back to work. So what they're saying basically is that they've got enough people who can do the job in the UK. So why get people from the overseas to come take up the job when they've got people who are highly skilled and trained for this job? So they also believe that they can train on the job in this sector, and it is up to businesses as well to invest, be that wages or to improve terms and conditions to make this a more attractive industry. By those running care homes say that overseas recruitment is essential, but those who are running care homes are saying that overseas recruitment is essential. So basically what they're trying to do now is that they're finding a way to make sure that employers train people who are already in the UK, equip them, pay them better wages, which is one of the reasons why most people in the UK are not taking up the job of care assistant. The pay is ridiculous. So they're trying to make sure that they do all of these things internally, which is why many of the MPs and the members of our advisory committee are calling out for the end of the health and care visa. So my question now is, if they decide to end the health and care visa, what happens to people who are currently on the visa category? What happens after 3 years? Won't they be able to renew their visa? That's the question that should be asked. However, it's the UK. They can decide to make any policy and nothing is going to happen. Their decision is definitely going to be prioritized. So that's not about that. So if you have any thoughts around this whole idea of the health and care visa being stopped, please state in the comment section. And if you have any contrary thoughts around the information that is circulating in the media right now in relation to the topic mentioned, then also please state your thoughts in the comment section. And if you find the video resourceful, please click on the like button. If you're coming across my channel for the first time, hit the subscribe button to join the amazing growing family. And my returning subscribers, thank you guys for being here. I really do appreciate you guys. So this will be the end of this video, and I will see you guys in my next video. Thank you.